The RTI Global Gender Center has affiliates from all around the world. Really glad you came on this Friday. So if we just wait another minute or so, then we're going to get started. But I just want to make sure I welcome those that are part of the affiliates of the RTI Global Gender Center. And if you're not, you can join. It's very simple. I also want to welcome all the local universities that are our partners, or those that want to be our partners or have been our partners, and the students that have been part of RTI. So again, I want to welcome you. I'm going to give it one other minute as people are coming on. I know that most of our days are from one meeting to the next. Most of us are not driving or running from one room to the next. We're just Zooming from one Zoom to the next. We could take this 1 minute to give a thought to the people in Ukraine. We have friends that are part of our In Women's group that I've been getting pictures from what's happening in the buildings. We're all getting it in the news as well. And there's organizations. I know this morning I gave to one Ukrainian. I couldn't even read the language, but then I've got one that translated it. And then our institute is also working on a donation to Ukraine and matching any personal donations. So it's nice to be able to do something that's active besides our love and prayers. Okay, it's 2:02. So again, I want to just welcome everybody that's local or global, if it's morning, afternoon, or evening, to this RTI Global Gender Center presentation, and also in partnership with WomenNC. We've been in partnership with WomenNC for over 3 years. Actually, it started about 4 years ago. And what we are involved with, as you know, as you can see, I even washed my new shirt to make sure we are here. Isn't, you know, gender is a spectrum, but right now we're talking about empowering young women scholars. As one aspect of what the RTI Global Gender Center does is we have some of our affiliates that we call femtors instead of mentors, who work with scholars from local universities. And that's just been a wonderful thing for the last 3 years. And so I'm going to not speak about this, but I'm going to turn this over today to my colleague, my special colleague, who I've worked with for 16 years, Dr. Felicia Brown, who's going to tell you what it's like as she's been a femtor for the last 3 years. So I will turn it over to Dr. Brown. And thank you for coming.
Thank you, Dr. Rexberg. So yes, again, welcome to this event. We are really glad you're here. So throughout today's event, please note your questions and comments in the Q&A box if you're in Zoom, or in the comment section if you're viewing the event on Facebook. We will monitor these spaces and try to get them answered at the end of the presentation. If we can't, in the interest of time, we will definitely get back to you. The presentation is designed for a North Carolina audience. On March 14th, our scholars will give a similar presentation to a global audience at the UN's Commission on the Status of Women. We hope that you can join us then too. So today you will hear the work of 5 dynamic WomenNC scholars from 3 area universities. Each of these scholars has been femtored by social science researchers from our Global Gender Center, who work with these scholars to produce actionable research with public policy implications. And so, yes, as Dr. Rexberg said, I've been very fortunate to have served as a femtor previously. And this year in my role, I worked with scholars to teach them on research methods through a workshop held last summer. And so in a moment, you're going to hear about the products of their efforts. So they not only engage in research, but they also develop policy solutions to improve the lives of women and girls. They also engage in advocacy related to those solutions, so to move the needle forward. Today's exposition is, in part, preparation for their presentation at the NGO Forum at the UN Commission on the Status of Women on March 14th. So now I will pass this to WomenNC board member, Dr. Ashley Marshall, today's moderator. She's a social science justice practitioner, researcher, and co-founder and deputy director of Forward Justice, a law, policy, and strategy center dedicated to racial, social, and economic justice in the U.S. South. Dr. Marshall.
Thank you, Dr. Brown. We're so excited for today's presentation. In today's presentation, our WomenNC scholars will examine various social inputs needed to concretize women's empowerment including sexual and reproductive health and education and care, robust childcare systems and services, quality and affordable housing, and broad-based commitments to environmental sustainability. Again, to learn more about WomenNC, please visit our website at womennc.org. And with that, I will turn it to the scholars, and we are so excited to hear from our first scholar, Margaret Gaw.
Thank you so much. Hello, everyone. I really appreciate the opportunity to be here. My name is Margaret Gaw. I'm a senior at Duke University. May I please, thank you so much. Okay, my project is focused on reproductive health care during COVID-19 in Durham County. Next slide, please. Thank you. The purpose of this project is multifolded. So first, I wanted to identify the barriers and enablers of access to high quality, affordable, accessible reproductive healthcare in this county, and also investigate how the COVID-19 pandemic has impacted reproductive healthcare, specifically at the Durham County Health Department. And then taking this forward to advocacy, I wanted to create an evidence-based, comprehensive infographic with pertinent women's health information so that patients could access high quality information during this time. A lot of this project was motivated by personal experiences working as an EMT in Western North Carolina and also as a doula at the UNC Women's Hospital, witnessing firsthand how this very stressful time during COVID has impacted people's experiences in healthcare, as well as access to healthcare. And ultimately, I'm very passionate about gender equity in medicine and working toward a system that is truly compassionate, that truly delivers high quality maternal and reproductive healthcare. The goal of this project is really to investigate those aims within Durham County and at the Durham County Health Department. So defining the issue, as we all know, this pandemic has led to very significant loss of lives, jobs, housing, and all of these things affect access to care. The Durham County Health Department saw an approximately 2,000 visit decrease in their women's clinic during this time. And that aligns with data seen in many different places, including through the CDC's National Breast and Cervical Cancer Early Detection Program, which saw approximately 85% decreases in both routine screenings for both of those. So I really sought to look through this secondary data, this existing literature, to see what exactly were the issues in reproductive health during this pandemic. And a lot of it resulted in just realizing that all of these losses due to this time really affected women's access to care. Whether it was the pregnancy circles that the Durham County Health Department did to create community for pregnant people during that time, which had to go virtual, which, led to barriers in terms of people's access to technology and to that program, or whether it was just fear of interacting with a health system, which led to fewer of these routine screenings. There was a clear drop in care during this time. Next slide, please. Thank you. So what now? Really, this project centers on partnering and advocating with the Durham County Health Department. And the goal, again, was to create something accessible, something tangible for individuals to be empowered in their healthcare. This led to 7 things to know about reproductive healthcare during COVID-19 in Durham County, outlining how to access appointments, transportation, what were the options, how can women take care of their health between visits, also information about COVID-19, how does one access the vaccine, information about how people who are pregnant, lactating, or trying to become pregnant, it is highly recommended to get the vaccine in those cases as well. So this information is online and it is a living document. So I'm very grateful for my collaboration with the Durham County Health Department to continue to try to empower women in their health and to bring accessible reproductive health care to women in this county. Next slide, please. So thank you so much. I put my contact information on this slide. If you have any comments or feedback, I'd be happy to hear it. And I appreciate your time today.
Thank you, Margaret. Our next scholar up presenting will be Gabriela Goodman.
Thank you so much, Dr. Marshall. My name is Gabriela, and I'm a junior at UNC Chapel Hill. And for my project, I looked at childcare access during COVID-19 and its implications in Durham, North Carolina. More specifically, my research focused on 3 key areas. Number 1, overall childcare access barriers. Number 2, effects of childcare on employment. And number 3, effects of childcare on mental health. Next slide, please. So in order to investigate these issues, I created a survey and received funding for a $10 respondent incentive from the Keenan Institute at UNC. And then I conducted participant recruitment through outreach to childcare providers and community organizations, and then was able to analyze the responses from the 75 participants that I received. Next slide, please. So issue number 1, barriers to childcare. Based on prior research, common childcare obstacles include high costs, lack of childcare slots available at daycares, and then childcare provider operating hours not lining up with parent needs. Based on my survey responses, high costs were the most common source of childcare barriers, and 40% of the participants that responded to my survey reported that high costs were preventing them from accessing their desired level of childcare. Other common barriers that they mentioned include COVID-19 exposure risk and lack of slots available at nearby daycares. So, to illustrate the effects of this, I'll use one of my survey respondents, and we'll call her Emma. At the start of the pandemic, the daycare that Emma used to take her kids to shut down. So as a result, Emma had to quit her job in order to take care of her kids. Now, Emma wants to go back to work, but because of her family's financial situation and high childcare costs, she's unable to afford the daycare that would allow her to return to work. Next slide, please. Issue number 2, effects of childcare access on employment. For additional context, a July 2020 study reported that 1 out of 4 women who had stopped working since the start of the pandemic had stopped working because of childcare barriers. Additionally, a pre-pandemic study estimated that annually the US loses $57 billion because of childcare barriers and the effects on the economy. Based on my survey responses, with improved childcare access, about 30% of the participants would look for a higher paying job, seek promotion or more responsibility at work, or pursue additional education and/or training if they had better childcare access. To illustrate this, I'll use another one of my survey responses. We'll call her Fatma. Fatma has dreams of pursuing a PhD, but because of high childcare costs and having to take care of her family, she's been unable to afford to do so. Next slide, please. Issue number 3, effects of childcare access on mental health. 82% of participants reported that childcare concerns negatively impact their mental health. Participants that are experiencing childcare obstacles had a 30 percentage point higher likelihood of experiencing depression symptoms than their counterparts, and a 10 percentage point higher likelihood of experiencing anxiety symptoms than their counterparts. To illustrate this, I'll use another one of my respondents. We'll call her Ananya. At the start of the pandemic, Ananya was working remotely, and she's now working in person. She discussed the stress associated with working remotely and having her kids running around while having to meet a deadline for work. Now that she's working in person, she discussed the toll it takes on her mental health when she has to suddenly take off from work to maybe pick up her child from daycare because of a COVID-19 exposure. Next slide, please. Based on my survey results, I came up with 3 key recommendations to help people like Emma, Fatma, and Ananya. Number 1, aggregate resources. Number 2, invest in support for low-income individuals. And number 3, expand Durham pre-K. Navigating social services and financial aid is a complicated and overwhelming process that many of my respondents discussed. By making this more digestible and providing these resources in a way that's more easier to comprehend, people can better access the help that they need. And so this is an effort that I'm currently working on, creating a database of resources and then distributing this for individuals. Additionally, childcare access is an issue that intersects with a variety of other issues of inequities. Therefore, by investing in low-income individuals and empowering them, they can better access the childcare that they need to promote economic empowerment. Finally, Durham has a program called Durham Pre-K that provides free pre-K for households with an income that's 400% below the poverty line. But by expanding access to this resource to more families, more people can access childcare. As I previously mentioned, these recommendations can help people like the participants that I described, but it can also help address macro level inequities that stem from childcare and spur increased economic development. Next slide, please. Thank you so much for listening to my presentation, and my contact information is there, and I'd love to answer any questions that any of you have.
Thank you, Gabrielle, for that phenomenal presentation. Next up, we'll have Camille Lacueille.
Thank you so much, Dr. Marshall. Good afternoon, everyone, and thank you so much for being here today. My name is Camille Lacueille. I am originally from France, where I completed my 2 first years of university at Neoma Business School. I am currently a senior at NC State University, and I am majoring in business administration with a minor in women's and gender studies. My research question for my WomenNC project is, how can the Wake County Public School System deliver a comprehensive sexual health curriculum for all students under current North Carolina laws? Next slide, please. I would like to start by reading this quote from a high school student in Wake County, which is also the largest school district in North Carolina. We, LGBTQ+ students, need to learn. We deserve to be safe as well, because everyone else is learning. Why not us? When you come from another country, you unconsciously compare everything in your new environment with what you have always known. What struck me the most when I started my research for this project was learning about the laws regarding sexual education in North Carolina. Where I come from, we speak freely about sexual relationships, even in schools. Our sexual health curriculum is very comprehensive and inclusive. It allows us, students, young adults, to be safe and engage in physical relationships without engendering our health. Next slide, please. You may ask yourself why does comprehensive sexual health curriculum matters? A lack of comprehensive sexual health curriculum for all students has repercussions on physical health. It can lead to STDs, pregnancy, and prevent LGBTQ+ community from getting specific information to ensure their health during intimate relationships. Now, I would like you to all think about a time when you were physically ill. What were the consequences on your mental health? Did you feel good about it? Indeed, more than physical health, a lack of comprehensive sexual health curriculum also impacts the mental health of students, and inevitably their academics and professional achievements. It also increased bullying among sexual minority subgroups. Next slide, please. These are the methods I used for my research. I began with a literature review to identify gaps in existing research. I conducted informational interviews. I did one with a North Carolina state senator to understand more about the historical background of the North Carolina laws. I also spoke with a Wake County School Board representative who helped me understand the sexual education curriculum in Wake County and the differences between the one from Wake County and the one from North Carolina. I also interviewed the Family Life Program Director at the Post Center, a nonprofit organization dedicated to working with schools to provide health education to children. Through this interview, I learned that the Post Center organizes field trips with some Wake County schools during which the students learn about reproductive health. I will now share some of my key findings. Next slide, please. Those slides tell very compelling stories about our students, don't they? Did you expect the numbers to be that high? 60% in 12th grade. This means in a class of 10 students, 6 of them will have engaged in a sexual intercourse in high school. Next slide, please. Now I will ask you to take a look at this slide. It doesn't matter what their sexual orientation is, Wake County students are engaging in sexual relationships. Next slide, please. So here are the key findings from my research. In Wake County High School, teachers, nurses, and guest speakers are not permitted to give information about contraceptive nor abortion referral service to students. In 2018, in North Carolina, young people accounted for 66% of new chlamydia diagnoses and 48% of new gonorrhea diagnoses. This means that youth actually represents more than half of the diagnoses of the state, which is a very high number. ShiftNC, which is also a nonprofit in North Carolina, study found negative consequences for the LGBTQ+ students in Wake County due to the lack of specific information for their needs. In fact, one student mentioned that he was told by the sex education teacher that the teacher was not legally allowed to respond to LGBTQ+ related questions. Health educators from the Post Center do not demonstrate the proper use of condoms, which definitely constrain the education fresh students receive at schools. Next slide, please. So here are some of my recommendations based on my research and my findings. Creation and distribution of comprehensive sex education resources for all students. This includes LGBTQ+ students in a form of brochure. I recommended them to be distributed after class to all students and not just available in teacher's office, admin office, or guidance counselor office to diminish any hesitation to access those resources. The Healthful Living course, which is the course where Wake County students are taught sexual education, often taken in 9th grade, should instead be made mandatory in the last 2 years of high school. As the figure we've seen before, this is the last 2 years of high school where students are more likely to engage in sexual relationships. I also require training and qualification for Healthful Living teacher, because right now in North Carolina, everybody like a gym teacher can teach this class without a proper training, and this greatly impacts the quality of the teaching. Next slide, please. Thank you so much for listening today, and here my contact information. Do not hesitate to reach out if you have any questions. Thank you.
Thank you so much, Camille. Next up, we will have Brittni Howard presenting on behalf of Sarah Luber.
Thank you so much. As Sarah's femtor, I'm very honored to be able to share her research with you all today. She is unable to be with us due to health reasons. Sarah's research, the green feminine stereotype and the eco-gender gap, how gender impacts sustainable consumption and the triangle area, is critical and timely. especially given the UN's latest report last Monday on the devastating statistics of irreversible environmental damage headed towards the next generation. Next slide, please. The green feminine stereotype and the eco-gender gap is the idea that women are socialized more frequently from an early age to participate in these green behaviors, which are often dubbed as pink behaviors due to their association with femininity. This has caused an inequality or gender divide in the number of men who engage in renewable consumption or behaviors. Next slide, please. Sarah worked very hard to obtain an IRB waiver from NC State to conduct a virtual in-depth interview with an environmental professional in Durham and to conduct a literature review. She developed an interview discussion guide and conducted her search using the following terms: green feminine and feminism, and sustainability or ecofeminism in both PubMed and Google Scholar. Ultimately, it yielded 21 articles she included for her analysis. Next slide, please. Her findings supported her argument that there is indeed a gender difference in these seemingly green behaviors, especially in regards to household product consumption, such as plastics, cleaning supplies, and eating ware. Here's a quote from her in-depth interview participant that just reiterates her findings. Her data revealed that gender norms play a large role in why women seem to engage in more green behaviors than men. And she also found other potential solutions to address these disparities in behavior. Next slide, please. So we've all been down the aisles at Target, Walmart, CVS, wherever you go shopping, and you've seen a clear difference in feminine targeted products. Next slide, please, versus masculine branded products. Next slide. And even though popular sustainable product manufacturers like Grove have become more progressive than other companies have been historically, you still see a lot of female stereotypes perpetuated in their marketing. Next slide, please. So Sarah's policy recommendations included the following, and the first one is a very large undertaking, but it was something she showed a lot of interest in and wanting to pursue later on in her career, which is a rebranding of products for more gender neutral marketing. And we all kind of know it's important versus, seeing pink things and blue. We all know that story, but just taking it a bit deeper even in product location as well. And more urgently and locally, she really wanted to look into lower taxes on sustainable products or ways to offer tax rebates, as well as recycling incentives, which are actually being used in many countries around the world, such as reverse vending machines for product returns. And actually, she learned that Durham at one point pre-COVID, just before the pandemic hit, was looking into 10-cent vouchers for every plastic bag that was avoided in local grocery stores. And so she was trying to get conversations around that going again as well. So thank you so much for being here and letting me tell you a little bit about Sarah's work. Her full research paper will be available on WomenNC's website shortly, and I hope you check it out. Thank you so much.
Thank you, Brittni. Up next, we'll have Kerry Rork.
Hi, my name is Kerry Rork, and I'm a senior at Duke University studying history and political science with concentrations in law and governance and normative political theory, respectively. My research is with WomenNC on housing insecurity in Durham, North Carolina. Next slide, please. So this is a table of contents of basically what I'm going to be talking about today, but the first thing will be on the historical housing trends in Durham and how those are continuing to permeate today. Second will be on housing in the pandemic and how a lot of existing housing trends were exacerbated. And finally, I will go through 3 housing solutions for Durham, North Carolina. Next slide, please. I would like to open with a quote from one of the many residents in Durham who is facing housing insecurity today. In this interview with Legal Aid of North Carolina and the Durham Eviction Diversion Program, we asked how the COVID-19 had impacted her home. She stated, "I paid my bills the entire summer, and now I need help because I have no money. Now you're going to tell me there's no funding left. My bills are due now." Next slide, please. In Durham, North Carolina, and around the country, thousands of individuals face homelessness every day. Importantly, beyond the immediate impact, such as shelter and physical safety, housing insecurity's implications extend to areas such as educational outcomes and the stability of family units. During the COVID-19 pandemic, existing housing insecurity was exacerbated, reaching unprecedented levels. Although recent data indicates that the economic hardship of the pandemic has decreased from its peak in December 2020, the pandemic continues to wreak economic havoc on communities around the United States. Despite the allocation of American Rescue Plan funds, according to the Center on Budget and Policy Priorities, as of September 10th, 2021, 11 million adult renters, or 15% of all adult renters, are behind on rent. Within this percentage, Black populations were disproportionately represented, making up 22% of those households. Statistics from the Pew Research Center further indicate that employed single mothers experience the greatest decrease in employment and therefore one of the greatest decreases in housing stability. In Durham, North Carolina specifically, 45.6% of households rent, proof of the large need within this community. Additionally, on any given night, 590 people experience homelessness in Durham. And that 590 is a low estimate given that these numbers have likely gone up since the start of the pandemic. Next slide, please. In my project, I investigated the causes and effects of housing insecurity in Durham, North Carolina. I particularly focused on data related to the COVID-19 pandemic that, as mentioned, exacerbated existing housing insecurities. Using interviews from individuals struggling to maintain their housing and data from local and national sources, I first established the need for new housing solutions in Durham. My research methodology was then a mix of a qualitative and quantitative literary review. With this information in mind, I investigated solutions around the country. Next slide, please. I conclude that the following three options would be appropriate to the housing crisis in Durham: the development of affordable housing, the formalization of the status of landlord, and continued educational outreach. Under Mayor Steve Schewel in 2019, $95 million was allocated for the development of housing for low to moderate income residents. This includes the construction of 1,600 affordable housing units, aid to 3,000 low-income renters or homeowners to remain in or improve their homes, among much else. What is important to note that is, given the influx of large corporations like Apple and Google, many more will face homelessness than did before. Therefore, we must allocate a percentage of this funding to the development of affordable housing that is actually affordable for Durham residents. The second is the formalization of the status of landlord. As was made clear with the client stories that were investigated throughout this project, landlords are able to exercise unruly and arbitrary power outside the restraints of law. This makes it easy to manipulate and harm tenants. In response, the city of Philadelphia is one of the first to establish the position of landlord as one that requires a commercial activity license for all properties with more than 4 units. Falling under the definition of a business owner, the landlord would be mandated to receive a commercial activity license in order to rent units. This solution creates more checks on the position of landlord, such as housing authority inspections and continued governmental intervention on behalf of both the landlord and the tenant. Because of the difficulties in completing the documentation and the following payments, it incentivizes the maintenance and protection of properties. Furthermore, by creating a list of business owners in Philadelphia that are actually available on the city websites, including landlords with the addresses, no landlord operates outside the view of government. Finally, I want to discuss the importance of educational initiatives throughout the city. Rather than responding as the cases arise, we need to consider proactive methods that ensure future stability and security. The legal jargon surrounding housing cases, coupled with the complexities of rental rights and statuses, make much of this information inaccessible to residents around the country. There is power in knowing to say continuance, or the pushing off of a case for a few months, in a courtroom that many do not comprehend. For Durham County, I would recommend creating a guide that relates to the changing housing circumstances. During the pandemic, there were eviction moratoriums, rental assistance programs, among much else, that were difficult to follow and involved numerous qualifications. The guide would provide regularly updated information for Durham residents on housing policies. Additionally, we provide tools if one was facing an eviction, like resources, things to do and know, and definitions of legal terms. The complexity of legal jargon and the outcomes of eviction make such a solution ever more pertinent as individuals continue to face housing insecurity. These three solutions, though not enough to eliminate all issues surrounding housing, provide a means of eliminating some of these risks. Its importance has only grown as the pandemic continues to wreak havoc on communities around the country. Next slide, please. Thank you so much for your time. And if you have any questions, feel free to reach out to me at that email or phone number.
Thank you so much, Kerry, for that phenomenal presentation. All right, it is now the section in our program where we want to open up questions to the scholars to have them explain more about their research and just answer any questions that we've received either in the chat, Q&A, or on Facebook Live. And so we have a couple of questions already in the Q&A. The first question, this is for Gabriela. You have one question. Did you look at nannies as well, or just accredited childcare facilities?
Yeah, thank you so much for that question. So I looked at a combination within the survey. I asked people about the different types of childcare that they're currently accessing. So that included things like nannies or more informal care, such as grandparents or friends taking care of kids, as well as accredited daycares. And so when asking people about the obstacles to accessing childcare, it also included obstacles to accessing any type of childcare that maybe wasn't an accredited daycare.
Wonderful. All right, I see there's questions in the chat as well, so I'm going to toggle back and forth between the chat and the Q&A. So next question, I believe this is for Camille. Question for Camille specifically, are you going to keep going with your research project and enact your recommendations?
Yes, so I was planning to do a sample of the recommendation I want to implement with all of the resources for the students. And with that sample, I plan to address the superintendent of Wake County School, which is Christine Kirchner. I don't know if she's attending this meeting, but so yeah, I was planning to actually organize like an appointment with the school superintendents in order to actually implement the resources I want to give to students.
Thank you, Camille. Additional questions that we have. Can Gabby speak to the tool she described that will help families find childcare? Where will it be distributed?
Yeah, so I'm hoping, and what I'm currently working on is creating a database of resources that are relevant to helping people find childcare options and access to support in finding childcare, and also information and tips related to navigating those resources, in addition to kind of adjacent resources that help with issues that often intersect with childcare barriers, for instance, food insecurity. And then I'm hoping to distribute this resource throughout the community. So looking and partnering with community organizations and other institutions within the community. So for instance, religious groups that maybe have access to a large group of individuals who may need this resource or who would find this resource accessible and helpful.
Wonderful. Thank you. One of the next questions we have, this is for Margaret. Did the lack of funds and access to healthcare factor into the decrease in the cancer screenings in comparison to the impact of COVID?
Thank you for that question. Yes, I think definitely seeing how COVID exacerbated already existing issues became very evident in this research. Some specifics for that, in especially healthcare systems already, straining, COVID just adding other layers of stress. But, for a woman who already couldn't get access to transportation to a cervical cancer screening, COVID just sort of adding on to that. So I definitely saw that the lack of funds and access, were just exacerbated by COVID.
Thank you, Margaret. So we have a question for Kerry in the chat. Will Kerry be speaking to any Durham County officials to speak about her policy solutions?
Yeah, so my whole project, one of the biggest things that I wanted to do was center it on the community. So all the research that I did, all of the data that I gathered, I continually spoke with several organizations locally. So organizations like Southern Vision Alliance, the Realtor Society in Durham, as well as a few members of Durham City Council. And my goal is to bring these solutions to Durham City Council because that'll be the most effective way to support this work. And I definitely have a few individuals who are interested, as well as I'm currently in the process of applying for a grant that will help with the creation of this guide to Durham housing, especially given how complex housing has become in this pandemic.
Thank you, Kerry. It's so awesome to hear from each of you scholars around how your work is going to live on and move forward and really be impacted and implemented in community. So we have another question here in the Q&A, and we'll just kind of go around and let everyone answer this question. What are some of the challenges you faced during your research, and how did you deal with them? And we can start, Camille, if you want to start off.
Yeah, of course. I think one of the most challenging items is definitely time, because, this is like, we're very passionate about that subject, but it does take a lot of time. So you just need to be very organized and just, set up times you were working a lot on your projects. And another matter that were, I think, very challenging was the RIB. I didn't have the chance to actually get one on time, but it is like a very long process. So, if you actually want to implement one in your research, you need to start very early.
Gabby, you want to go next, and then maybe Margaret?
Yeah, so I think for my research, the biggest challenge that I faced was participant recruitment and trying to get a sample that was as representative as possible. And so I think it was something that was really helpful was being able to get funding for a survey incentive to help get a more wide array of individuals respond to the survey, and then also just being really persistent about reaching out to people within the community and asking for help distributing the survey and reaching out to childcare providers.
Thank you.
Yes, I think something that was really important from the start was using this as an opportunity to contribute to ongoing work in reproductive healthcare in this county. And so a challenge was really just finding a partner in advocacy who kind of had the bandwidth to work with me. And I'm really grateful for the Durham County Health Department and their women's clinic for kind of being that person. But I think just originally being able to find that partner.
Yeah, I think in a similar vein as with the conversations on IRB, I had some difficulties with completing the IRB, and because I'm dealing with a uniquely vulnerable population, and that includes vulnerable in the sense of income status as well as citizenship status, there's a lot more ethical complications that come with that. And especially because I wanted to use a lot of interviews. Because I wanted to center on the voices of those who are truly impacted by this. And so I ended up having to use interviews that I actually had previously done with the Durham Eviction Diversion Program over the last year, and only the ones that were made publicly available through their process and their vetting, and making sure that everything was de-identified. But yeah, it definitely was a limitation and a difficulty given just the population that I'm choosing to work with.
Thank you all for sharing. And in spite of all of that, in spite of the struggles and joys with RRB that all researchers know and understand, you all have produced some phenomenal research projects, and we hope you are extremely, extremely proud. And again, just understanding and hearing from you how they will be implemented into the community is so powerful. All right, we have a couple more questions in the chat. This one, let's see. Question for Kerry. Can you please speak more to the gender dynamics with male landlords and female tenants?
Well, I think one of the most important factors is that given the data, what we know is that the most vulnerable population in Durham is Black single mothers. And so gender plays a pretty fundamental role, as well as race plays a fundamental role in housing in Durham. And it does around the country, but uniquely you can see that in the data in specific in Durham. I don't know as much about the gender dynamics between landlords, and that's actually part of the difficulty with what I'm saying. One of my solutions being the formalization of the status of landlord. We don't know who these landlords are, and that's why it's such a dangerous thing. Is I could choose to go buy a property today and rent it out. There's no checks on anything. It is a very, very, very loose process, and so I wish I could say more on that kind of dynamic, but that's one of the things that's so problematic about this area, and that is something that we really need to deal with is knowing who these landlords are and who's really responsible for these properties.
Thank you, Kerry. A few more questions. For Gabby, did race, socioeconomic status, educational level factor into your findings regarding childcare barriers?
Yeah, that's a great question. And then originally when I had this research question, that was a big part of my motivation. I was interested in seeing how the divides played out between different demographics. Unfortunately, because of sample size constraints, I asked about those questions in demographic factors and did break it down. And there were disparities, unfortunately, along the lines that we'd expect and coincide with disparities in other areas. People of color, for instance, are facing these barriers at a higher level. But because of the sample size constraints, I chose not to present that data, and instead rather I presented the overall demographics of my sample and my paper, and chose to instead also draw on the literature to highlight that these barriers do break down and vary by demographics. And because childcare is something that's so central to economic empowerment, lack of childcare access isn't something that perpetuates these inequalities.
Thank you, Gabriela. Question in the chat, and I think we have time for a few more. In analyzing your data and reviewing your results, did it highlight or lead you to other questions you want to explore in the future, or maybe a question you wish you would have asked in your original research? And we can kind of go around and have everyone respond. And we can start with Camille.
Right. Thank you for this question. So when I look, at the physical consequences of the lack of sexual education in North Carolina, I also read, about STDs and pregnancies in general, and not only for students. And for example, on the, I think it was the status of women in North Carolina, which is a report that has been made in 2019. They've talked about how STDs, for example, impacted women more than it impacted AD honor sexes. And I think it was also very interesting, to work on the impact of STDs and pregnancy to women compared to men or, other people. And I think this is really something worth looking for.
I can hop in with this question. I think reproductive health in the pandemic, a lot of questions about telehealth and the use of that in medical access and how to maybe channel that to reach more women in this county. I'd be curious to ask more questions and maybe do more research on its role.
Yeah, I think housing is such a difficult topic that you could take it at any way you want. Every single call I'd hop on with a new organization, they would tell me the real problem is the minimum wage, or the real problem is what some call the criminal legal system because it's not really just, or it's policing, or it's it's just, you could take this project in a million different ways because housing is so fundamental to so many different outcomes that I think as I was going along, I had millions of questions of like, oh, I could frame this all on education and like how educational outcomes are entirely shaped by whether or not you have a stable home. So yeah, like, and that's why like this is like housing has become a topic that I'm very, very passionate about and like have continued to work with at Legal Aid of North Carolina and the Durham Eviction Diversion Program, because you see that this is one of the roots, like the real roots of what's happening in our world.
I can go. So I think one thing that I'm interested in exploring more is how kind of access to childcare and the implications varies by demographics. And then another thing is because my research focused on the experiences that individuals had during COVID, I'd be really interested to do further research on kind of the long-term effects and whether potentially a disruption to childcare, specifically during the pandemic, is like impacting people a year, 2 years from now, and what the extent of those implications are.
Thank you all so much for your responses. I think we have maybe a time for one more question for us to kind of go around and hear from all of our scholars. We have another great question in the chat. What was your favorite part of the research process that you experienced with your work? If you all have some immediate responses to that as well.
I think first presenting, to the world what we have found and finding solution is very satisfying part. And I'm so excited, that the policy recommendation we came up with, if they actually implemented, that would be such, the consequence of such a great work. Then I think this is going to be the most exciting part.
I think it's really cool to be able to define an issue through, literature and data, but then take that and do something tangible with it, and which led to the infographic for the women's clinic at the Durham County Health Department. But just that process of taking something and then putting it toward a sort of tangible, accessible thing.
Yeah, I would say meeting with new people is always my favorite thing. I would get so excited when I get to go on a call with another like local nonprofit and a group of organizers and be like, I have this incredible opportunity. I can bring whatever you all are needing right now, and I can bring it to a bigger level. And that's just like really powerful to have the resources and the opportunity to really uplift work that's been going on for so long, and really be able to like use resources and opportunities and privileges that I have to make sure that the voices of the community are being heard.
Yeah, I think for me, I really enjoyed being able to really delve into the issue of childcare access, but also being able to delve into the research process, because I think that's something that I want to go into in the future. But it was amazing to be able to take a project from scratch and kind of come up with the idea and then go through each step, IRB approval, literature review, and see some final product come to fruition. And then also along the lines of what other people said, I think it's always a lot more meaningful when I can see my work being used within advocacy and to have a concrete impact.
Oh, thank you all. That's phenomenal. So I think we'll take thank you all for the wonderful presentations that you had. So powerful to hear from you all and just your journey on becoming a scholar. It's so we're so happy we can support you. And just the research topics, again, are so powerful and so critical to our lives and the lives of women. So just really congratulations on phenomenal work. So we just want to take a second to say that all of our scholars presentations will be online at womennc.org. Their actual presentations today, their policy note, and their written paper will be available online. You can also go to the website to register for the next presentation, which is again on the 14th for the UN Commission on the Status of Women, where our scholars will be giving a similar presentation as well. So please visit our website to learn more. And if you'd like to donate to WomenNC, if you were inspired by the presentations that you heard and want to donate in supporting women as they develop research skills to take themselves on later in life, we also offer you to visit our website to donate as well and sign up for the newsletter to learn more about important events like this and some of our other great work with our Lunch and Learn series. So we just want to say again, thank you all. Thank you to our WomenNC scholars. Thank you all for who's watching on this event today and on Facebook. Thank you all for tuning in. We hope you can join us again. And again, please visit our website to learn more. And if you have any questions for us, and if you would like to get involved. Thank you and have a great day.
And thank you, Dr. Ashley. And we thank you, Shane, for doing the webinar. And we're so proud of you scholars speaking and becoming new leaders in doing research. It's never easy, but you are persistent and it's the beginning. Thank you all. And thanks for coming on a Friday afternoon. We give you 4 minutes back. Thank you.
Thank you.
Are we off, Shane?